SI1, the Jing-Well points, lesser Marsh. SI1 location on the little finger, point 1 tune from the ulnar corner of the nail. How to find? This point is located at the junction of two tangents drawn along the lateral and proximal border of the nail, approximately 0.1 tune from the actual corner of the nail. Heart 9 is located at the radial corner of the nail. Needling 0.1 to 0.2 tune vertical or obliquely in a proximal direction or prick to bleed with a needle, lancet or three-edged needle. Caution is painful point. For the actions and indication, SI1 expels wind and heat. It opens the orifices, revives consciousness, opens the channel, benefits the breast. For the special features, SI1 is a Jing-Well point, metal point, and 3-point. Like most of the well points, SI1 is used for excess pattern to eliminate pathogenic factors. SI1 expels wind heat in the exterior attacks, especially when the symptoms affect the head and neck, causing stiff neck and headache. It is also good to treat acute tonsillitis from inhalation of exterior wind heat. It also extinguishes internal wind and promotes resuscitation in cases of internal wind and phlegm, blocking the orifices and causing sudden unconsciousness as in wind stroke. Apart from its role in exterior patterns, it can also be used as a distal point for channel problems of the neck, such as chronic stiff neck or acute torticollis. Finally, it is an empirical point to promote lactation after childbirth, mostly in excess patterns. That is, when lactation is inhibited by the presence of some pathogenic factors or stagnation, such as stagnant liver qi. For the summary, it expels wind heat, aversion to cold, fever, febrile disease. It also extinguishes wind and promotes resuscitation, loss of consciousness from wind stroke. It removes obstruction from the channel, cold sensation below the heart, feeling of oppression and pain of the chest, pain in the ribs, stiff neck, pain in the back of the shoulder, pain in the arm and elbow. Clears heat, those with red eyes, nosebleed, thirst, mouth ulcers. It also subdues rebellious qi, those having headache, dizziness, deafness, tinnitus, stiff tongue. It also promotes lactation, those having agalaxia. SI1 is the Jing-Well point of the small intestine channel. In common with all the Jing-Well points of the yang channel, it has a strong action on clearing the heat from the opposite end of the channel in the head. Branches of the small intestine channel ascends to the ear, the inner and outer canthus, and alongside the nose, while its paired heart channel opens into the tongue. SI1 therefore has a strong effect on the clearing heat or pathologically ascending yang from the eyes, ears, nose, and tongue, as well as the mouth and throat, and is indicated for such excess disorder as red eyes, tinnitus and deafness, erosion and ulceration of the tongue, painful obstruction of the throat, mouth ulcers, drooling, and nosebleed. According to the classic of difficulties, the Jing-Well points are indicated for fullness below the heart, while the region below the heart specifically refers to the upper epigastrium. Like many of the Jing-Well points, SI1 treats fullness in the chest region as a whole and is indicated for oppression and pain of the chest and heart, cold sensation below the heart, and pain of the lateral costal region. In clinical practice, however, SI1 is principally used for swelling and abscess of the breast and disorders of lactation. Absence of lactation is primarily differentiated into two types: insufficiency of qi and blood resulting in inadequate production of milk, or stagnation of liver qi, which leads to obstruction and coagulation of milk in the breast. The small intestine primary channel descends to the center of the chest at REN 17, and these 2 points are frequently combined to treat insufficiency or total absence of lactation. Breast abscess is usually due to liver or stomach fire or transformation of exterior pathogens to heat. In combination with suitable points, SI1 may be used in any of these 2 patterns. Finally, in common with the other Jing-Well points, SI1 is used to revive consciousness and is indicated for loss of consciousness from wind stroke. As the entry point on the small intestine, little marsh revitalized the meridian. A marsh is a fertile wetland, a humid place where water collects, much like a well. As the metal point on small intestine, little marsh carries a resonance of metal. Its mineralizing, enriched quality of qi and blood, discriminating balance to assist the small intestine in its role of separating the pure from impure and the clear from the cloudy. When the small intestine loses its quality of discrimination, inappropriate behavior and maturity can influence behavior, replacing the purity, propriety, and joy in life appropriate to the fire element. The alternative name, small propitiousness, highlights the role of small intestine. Propriety is the virtue of the heart. The small intestine, the separator of pure from impure, where enhances by its resonance of metal, informs us of the importance of the ability to discern what is appropriate and correct, to discriminate in our consciousness. There is a filtering of all levels of body, mind, and spirit so that we can focus on with clarity, without cynicism, and with our body appropriately discarding what is impure. In order to appreciate, be inspired, be vital in our consciousness, the small intestine's role in assisting the purifying aspect of fire must function well. As the purifu to the supreme controller, it is a crucial role. When imbalance in the small intestine means our system becomes polluted, relating appropriately to others, touch, humor, sting in the tail, comments can become difficult, and loneliness, lack of joy, and a lack of confidence can result. This point can affect a rapid change of sensibility, as most Jing-Well points do. As its most distal point, SI1 has a dynamic effect on the opposite end of the meridian and dens the mind. This point can help clear mental model and increase the ability to assess and absorb ideas. The heart, the yin partner of the small intestine, opens into the tongue and affects speech. The speech needs to be clear and able to convey the intended meaning, the truth of the heart. Jing-Well points affect fullness below the heart. SI1 crosses with REN 17 and so also connects with this area in this way. Xiao reminds us that this is the first point after Han Shu Yin, the heart meridian, the paired official with small intestine. As the arm branch of the Taiyang, bladder, and small intestine, the small intestine pathway is the most superficial, and its symptomatology is mostly to do with the exterior and local problems. It is relatively rarely mentioned in point combination patterns for intestinal problems. As Jing-Well points, SI1 can help expel pathogenic factors, particularly from the opposite end of the meridian, that is the head and neck. The small intestine pathways connects with Dumai, links with GB1, affecting the eye, passes around the ear, and the lateral aspect of the nose, and can be used for tonsillitis, mouth ulcers, fever, chills, headache. It opens the orifices and promotes resuscitation in cases of internal wind and phlegm, blocking the orifices, causing sudden unconsciousness, convulsion due to heat, chest and intercostal pain, and tongue stiffness. SI1 can be used for ear problems, example yung tinnitus, given the pathway of small intestine travels to and through the ear and the use of Jing-Well points to expel pathogens. The vigorous nature of Qi at this point removes the obstruction from the channel. SO1 can be used for pain in the little finger and as a distal point for channel problems of the neck, such as chronic stiff neck or acute torticollis. Empirical point to promote lactation after childbirth when there is stagnation or a pathogenic factor inhibiting the flow and for problems affecting the breast.